Let's face it, people have sex. They always have and they always will. When individuals give their enthusiastic consent, sex can be very safe and enjoyable. Today we are here to teach you safe ways to engage in sexual acts in a non-judgmental approach. We recognize that sex acts are not always between men and women or with folks that have a penis and vagina. But in fact, sex can look so many different ways depending on sexuality and identity. Our goal is to not convince young people to have sex, but to empower them to make safe decisions if they choose to do so. Before we get into ways to prevent pregnancy and the transmission of sexually transmitted infections, I want to stress the importance of consent, or in other words, an agreement between two people to engage in an activity together. In the state of South Carolina, the legal age of consent is 16 years old. Basically, that means the law says that if you're under 16 years old, you cannot legally consent to sex or sexual activity with anyone over the age of 16. While the law does state that at 16 you may consent to sex, it is also important to receive consent from your partner. Consent can only be given if the individual is not under the influence of drugs or alcohol. In other words, they have to be in their right mind. Consenting to sex must be enthusiastic. If you ask someone for their consent and they seem on the fence or pressured, it's not consent. And you should never engage in that activity. And remember, consent can be taken back at any time. And if your partner says stop or no, it means you must stop.
Now that we understand that consent is the first way to engage in sexual activities safely, we can get on to birth control methods. Birth control is very low cost or even free, and there are numerous different methods available for teens. The most well-known is the birth control pill. These pills essentially stop you from ovulating, which is when the ovaries release an egg and must happen in order for pregnancy to occur. When taken correctly, birth control is very effective, protecting you from pregnancy about 99.9% of the time. But the pills must be taken every day at the same time of the day. Some ways to remember would be to set an alarm on your phone or place the pills somewhere you would see them and remember to take them. But if you think you would have issues taking a small pill every day at the same time, that's okay, and there may be a better method of birth control for you. Another option is the NuvaRing, which is a bendy silicone ring about 1 inch in diameter that is inserted into the vagina and, like the pills, prevents your body from ovulating or releasing that egg. The ring also protects you from pregnancy by making it more difficult for sperm to travel through your reproductive system to your eggs. The ring is worn for 3 weeks and taken out after the 3rd week. During the 4th week, you will have a menstrual cycle and then a new ring is inserted. The NuvaRing is about 99% effective, and in order to use this method, it is important that you are comfortable and able to insert and extract the ring from your vaginal canal. If you are unable or uncomfortable doing so, that's okay, and there may be another method suitable for you. If you are interested in longer-term birth control methods that do not require remembering to take a pill or removing a ring, an intrauterine device, known as an IUD, or a birth control implant may be right for you. Both of these methods require a quick procedure done by a physician or midwife in your doctor's office. The IUD is either a copper or plastic T-shaped rod that is implanted at the top of your vagina on your cervix. The implant is a very small rod that is implanted in your arm under your skin and will not be visible. The implant can protect you from pregnancy for up to 4 years and the IUD for 3 to 6 years. With both of these methods, it is common for you to not have a period at all while you have the device inserted. It is important to note that there can be some discomfort with the procedures, and some people experience cramping after receiving the IUD. It is very important to remember that while these methods of birth control can protect you from unwanted pregnancies, they do not protect you from sexually transmitted infections. The only way to prevent the spread of sexually transmitted infections is to use barriers. Barrier methods essentially mean that there is something preventing direct contact of one person to another.
The first barrier method we will discuss is a condom that is worn on a penis. Condoms should be worn not only when penetrating a vagina, but also for anal and oral sex. First, check the expiration date on the back of the wrapper to ensure that it is not expired. Then it is important that the condom fit correctly on the penis and that there is room on the tip. because this is where the semen will collect after ejaculation. Despite what you may hear, condoms should never be worn more than once, and you should never put on more than one because it increases the risk of the condom breaking. And remember, even if you're not having sex with someone with a vagina, it is still very important to always use a condom during anal sex because there's still a risk of spreading STIs. Many women or people with vaginas are unaware that there is a condom made for them. Here we have a female condom which sits inside the vaginal cavity during penetrative sex. The condom must be inserted into the vagina and the outer ring remains outside. This is a great and effective method of not only birth control but STI prevention, and it allows for women to empower themselves by knowing they have their own protection. Not everyone having sex is having sex with a person with a penis or engaging in penetrative sex. Many people utilize oral sex, and it is possible to spread disease through oral sex, but there are ways to protect yourself from transmission. A dental dam is a product made out of the same material as condoms. It is essentially a sheet that is replaced over the outside of the vagina or over the anus to protect your partner from STIs during oral sex. While dental dams are harder to come across, they can easily be made out of condoms by cutting the tip off and making a cut vertically to create a rectangular shape. The dental dam method is especially important for lesbian and bisexual women in protecting themselves from transmission of STIs. If you have had unprotected sex or if the barrier method has failed, then there are some important signs to look out for that could indicate the spread of a sexually transmitted infection. If you experience any of the following or just have a question, report to your care provider immediately for treatment. Sores or bumps on genitalia or anus, pain or burning while you pee, discharge from the penis, odd or foul-smelling vaginal discharge, vaginal bleeding when you're not on your period, pain while having sex, pain in your abdomen, or a fever. Many of the common STIs that affect young people are completely treatable, so please do not hesitate or shy away from receiving medical attention.
In Charleston, there are resources for you. Planned Parenthood in West Ashley provides condoms for men and women, as well as STI testing and pregnancy screenings. The other services provided at Planned Parenthood Charleston are abortion services, birth control, health care, HIV testing, services for LGBTQ+ community, men's health care, emergency contraception, and women's health care. Other locations in Charleston that provide free male condoms are the Center for Behavioral Health, Daniel Island Barbershop, Low Country Infectious Diseases, Nubian Designs Hair Salon, Smitty Super 7 Barbershop, the Hope Clinic, We Are Family, and the YWCA of Greater Charleston. Dental dams and female condoms can be found in most pharmacies. We hope you enjoyed this video and feel more empowered to take your sexual health into your hands after viewing. While birth control and barrier methods can lessen the chances of you becoming pregnant or transmitting or contracting a sexually transmitted infection, there are still chances of both happening even with caution in use. The only 100% way to avoid infections or pregnancy is to not engage in sex acts. While for some folks that is easy, we understand that sex is going to happen no matter what. Sex can look different for everybody, and there is no right or wrong way to have sex as long as it is consensual. This can mean that you like to have sex with men, women, people who don't identify as a gender, both, all, or none, and that is okay. Whoever you choose to have sex with, make sure that it is always safe and consensual. Just remember, if you are going to engage in sexual acts, yes must be said by your partner, no can be said at any time, birth control is successful in preventing pregnancy 99% of the time, and barrier methods should always be used, no matter who you are having sex with.